Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this beautiful project of study and learning. Hypnosis is a powerful technique with which you will be able to help and improve the quality of life of a great number of your future patients. Remember, study the description of this video where you can find a link to free training classes on clinical hypnosis with several free ebooks. Obesity. Objective of the treatment with clinical hypnosis. Objective: that the patient thinks as thin. Previously, the overweight person was considered as a person who was in good health. However, now it is known that obesity has multiplied negative health consequences. It is now accepted that obesity increases the risk of diabetes, stroke, arthritis, hypertension, high cholesterol, stroke, sleep apnea syndrome, non-alcoholic fatty liver disease, coronary artery disease, dermatological, gastrointestinal, as well as kidney and bladder disorders, and certain types of cancer. Obesity means having an excess of fat in the body. It differs from being overweight, which means weighing too much. Weight can be a result of muscle mass, bones, fat and/or water in the body. Both terms mean that a person's weight is greater than what is considered healthy for their age. Obesity is considered by the World Health Organization to be the non-infectious epidemic of the 21st century. According to the origin of obesity, it is classified into the following types. Exogenous obesity: higher calorie intake than the body expends, less physical activity than the body needs. Endogenous obesity: dysfunction of the endocrine or metabolic system. Hypothyroidism, Cushing's syndrome, increased cortical hormone. Hyperinsulinism, polycystic ovary syndrome, frequently in young women. Hypogonadism, decreased testosterone hormone in men, etc. In 95% of cases, it is an exogenous obesity, that is to say, triggered by an excessive intake for the level of energy expenditure. Only 5% is endogenous obesity, or in other words, caused by organic pathologies, some of which are hereditary. Body Mass Index, BMI. The World Health Organization, WHO defines overweight as a BMI of 25 or more, and obesity as a BMI of 30 or more. The Body Mass Index, BMI, is a measure of the association between an individual's weight and height, devised by the Belgian statistician Lambert Quetelet, also known as the Quetelet Index. It is calculated according to a mathematical expression. Waist Circumference Index, another variable index in the assessment of overweight and obesity, is waist circumference. Waist circumference, which is closely related to the accumulation of adipose tissue with the accumulation of abdominal adipose tissue. It has been shown that the body fat distribution is also an important predictor of risk for obesity-related diseases. Thus, waist circumference is directly related to the risk of cardiovascular disease. A waist circumference 102 cm in men and 88 cm in women is a useful indicator of increased risk of obesity-related complications. Waist Hip Index. The Waist Hip Index, WFY, is a specific anthropometric measure to measure intra-abdominal fat levels and relates waist circumference to hip circumference in centimeters. The WHO establishes a normal level of 0.8 in women and 1.0 in men. Higher values would indicate abdominal visceral obesity, which is associated with an increased cardiovascular risk. In addition, this measure is complementary to the body mass index (BMI), since the BMI does not distinguish if the overweight is due to fluid retention, hypertrophy, or similar. The index is obtained by measuring the waist circumference at the height of the last floating rib and the maximum hip circumference at the level of the buttocks. Obesity. Android type, gynoid type. Android, apple-shaped obesity more frequent in men. Gynocoid, pear-shaped obesity more frequent in women. Depending on the body fat distribution, obesity can be classified as android or gynocoid. Android obesity is more common in males. It is characterized by an accumulation of fat above the waist, mainly in the abdomen. It is the most detrimental to health, as it implies a risk of high blood pressure, cardiovascular diseases, choleitis, stones in the bile duct or gall bladder, hyperinsulinism, and diabetes mellitus. Gynocoid obesity is more common in women and is characterized by the accumulation of fat in the lower half of the body, especially in the lower abdomen, hips, and thighs. Treatment of obesity. Most obesity is exogenous, that is, there is an energy imbalance between the amount of calories ingested and the calories consumed. Before starting therapy with the patient, it is essential to rule out any organic factor triggering the obesity. First of all, the patient is asked to make a self-record in which he or she should reflect his or her eating behavior and the pattern of physical activity habitual to him or her. Meals. Number of meals per day. Time of meals. Places where he or she eats. Usual way of eating and chewing, fast or slow. Type of food eaten. Quantity of food eaten. Physical activity. Kilometers walked per day. If you do any sport or go to the gym. Excursions in the countryside. Strolling, walking, outdoor activities. Types of games played. Sedentary activity. Television, listening to music, computer, reading books, board games. If there is a caloric consumption in this sedentary activity, etc. Once we have the data of the self-registration, we begin the therapy under hypnosis and will focus on reinforce the patient's motivation to lose weight, increase physical activity, apply aversive exercises to the massive food intake and to the consumption of high caloric foods, condition eating behavior to their usual times, specific places, adequate amounts, etc. Condition the patient to follow a healthy and balanced diet, dietary hygiene. If the patient is following some kind of diet prescribed by the doctor, under hypnosis we induce him or her to follow the diet to the letter and to the letter. If you're interested in continue learning about clinical hypnosis, watch our next video, Anorexia Nervosa. Remember to study the description of this video, where you can find a link to free training classes about clinical hypnosis with several free ebooks. If you have any questions, ask them in the comment area about this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.